TB pharmacology, something that is good to know if you're preparing for the NCLEX. They are respiratory medication, they are antibiotics. So we're going to talk about them. I'm going to give you fact about them, high yield fact, things you need to know for your nursing school or the NCLEX to pass it. So the first thing I want to let you know, these are antibiotics. They are antibiotics, but different classes of antibiotics. We don't talk about them too much, but they are antibiotic because the TB, tuberculosis is a bacterial infection. So they are antibiotic and they're going to affect the antibiotic. That's where we use it. The easy way to remember them is RIP. So there's four medication. I'm going to give you some of the key aspects related to that. Before that, tuberculosis, there's two types. There's a latent disease, right? That means you are PPD positive. So latent TB means PPD positive, positive PPD. You need only one medication, but it can take you for like 6 to 9 months. It can be a long time. The reason why we don't want you to become resistant to the medication such that the bacteria become resistant and then you get full-blown TB. If you get full-blown TB active, this is active form. You take four medications, which are very, very difficult to do. So the major nursing consideration when you're teaching a patient about TB medication is compliance. So you want to make sure you deal with the compliance. The patient is going to comply with those medications and they take it regularly. You cannot skip. You want to take it every day for 9 months. That's a very painful thing to do. Now, let me give you the first one. The first one is Rifampin. That's the R, right? Rifampin. This is the first medication. It's an antibiotic. It's going to affect the RNA polymerase. This is, you don't need to worry too much about it. This is the enzyme that used for the synthesis of the DNA of the microbacterium. The first thing you need to know is the side effect. So this is the side effect. Side effect about them is hepatotoxic. Okay, all of them are hepatotoxic, right? But they have a unique. So this is the unique. I will put 4 stars. The unique information about them is what the board was going to ask you. They change body fluid into what? Orange, red, all body fluid, saliva, tears, sweat, vaginal, even semen. So all of them is going to turn this color. So you have to teach the patient about this so that they don't worry about it. They don't get scared. They don't worry. These are what we call normal finding. They are normal. You don't worry about it. But you have to teach them, right? If it's a female who probably wear, if a male or female wear contact glasses, you tell them to wear what? Just a regular glasses, right? Wear regular glasses. Remove your contact, right? Your pad is going, under pant is going to be stained. So wear some pad under to prevent that, right? If you have dentures, remove the dentures until you finish the medication. Otherwise, it's going to get stained. What is the priority for this? The priority, I'll put it here. Priority information, okay, key. That the board, it become a priority. All this is not the priority, is what? Oral contraception become ineffective. Therefore, if it's a female, you tell them to wear a barrier method. So if they're taking birth control, you can still take it, but they can have to wear barrier. Somebody have to wear condom or female condom to prevent. But birth control, oral form is ineffective. It does not work well. You need a barrier method. So it's very, very important you tell the patient about this information. He also has some GI side effect, nausea and GI side effect. It's not important. So this is Rifampin. That's all you need to know about it. First antibiotic. Okay. The second one is isoniazid. This is what everybody know, right? Isoniazid. INH, right? Isoniazid. Everybody know about it because it's the most common one that we get prescribed. This is going to affect the TB cell wall, the bacteria cell wall, to prevent it from growing, right? Side effect, peripheral neuropathy. They'll complain about numbness and tingling of their fingers. It's okay. And it lead to vitamin B6 deficiency. They are all okay. They are not bad. So what do you tell them? NB teaching, where I want you to take vitamin B6 so that you don't have deficiency and then you don't develop peripheral neuropathy. They develop peripheral neuropathy because they have vitamin B6 deficiency from the medication. So take vitamin B6 to prevent that. That is key. The other thing is there's some patients that are more likely to get these peripheral neuropathy side effects. So you try to teach them about it. Very, very important. Patient is immunocompromised, HIV, right? Likely to get peripheral neuropathy. Pregnant patient, common. Elderly patient, patient with diabetes. So you have to be careful when you prescribe it on them, but still, they have to take it. The another thing about a side effect, they should avoid antacid, specifically aluminium antacid, which is like a Maalox. They cannot take it. This makes it ineffective. That's all you need to know. Isoniazid. Like I like to make things like straightforward. Don't worry too much about information. The key fact, and you go on. So RIP. The next one is P. This is a new medication that get replaced with streptomycin because of side effects. Pyrazinamide, right? Um, so this is the newer pyrazinamide. It replaces streptomycin because streptomycin has a bunch of side effects. What does it do? It lower the pH of the surrounding and then it kill the bacteria. What is the side effect? Increase uric acid. In effect, it causes gout. Therefore, you know what to teach the patient, right? What you're teaching. We drink a lot of water so that you don't form gout, you don't have kidney and stone due to gout, and monitor them for gout, right? That's all. And the last one is E. The E is ethambutol. This is because it's optic is based on the E eye problem, optic, right? Optic neuritis, right? Inflammation of the eyes. And then it's very important that you let them know about it. And so these people need eye exams. Very, very important. It can also cause peripheral neuropathy, but it's not the best one. So it can cause, if you, in case you see a question like that, yeah, don't worry. You can pick it because, but that's not number one. I don't think the NCLEX will confuse you. What this is known for is what optic neuritis. So the patient need eye exams, regular eye exams. They need to go see ophthalmology every 6 months. You got to have a scheduled appointment. Now, this is where people forget. All the TB medication have their problem, but they all affect. So this is the key things you need to know. They all affect the liver. That means your best teaching is to teach them to avoid anything that affect the liver. That is a priority. Let them avoid anything that will affect the liver. They all have their unique side effect, but if you see signs and symptoms related to liver failure, that means it's a priority. You need to intervene. So, what do you teach them? Avoid hepatotoxic drugs like acetaminophen, right? So instead of taking acetaminophen, I want you to take NSAIDs rather than that, right? Avoid that. Avoid like alcohol, ETOH, right? Avoid medications that also, if you take medication, you should that will affect the liver. You need to change it if you're on this medication, like um, um, cholesterol medications. They affect the liver, so your doctor have to monitor you that hey, you can be on these two medications that will affect your liver. What are you looking for? NCLEX tips. If they give you question and they want you to intervene that is affecting the liver, these are liver injury tips you need to know. Everybody should need to know this. Um, you're going to turn yellow. Join this. When you see join this in this patient, right? It's a bad problem. You need to intervene. When their stool will become clear colored because of jaundice, their urine is going to be tea colored. You got to be careful. Rifampin causes your urine orange red. It's different from tea colored. So a tea colored urine in a patient taking pyrazinamide, it means liver toxicity. You have to intervene. They are sclera ectorate, right? Or if it's African American, their tongue, look under their tongue. They will become anorexia, side effect of liver toxicity, and fatigue. I want you to know these signs. These are signs of liver failure. And the last one is pruritus, itchiness, right? And so it's because of the bilirubin. These things you have to know. So if I'm taking isoniazid and I have pruritus, it should concern you that this is liver toxicity. I have anorexia, all those times is liver toxicity, but they all have their own side effects, right? Rifampin body fluid is all normal. It's not something you should worry about. And the only thing you should worry about is birth control, isoniazid, peripheral neuropathy. Don't worry about it. Give them vitamin B6 and Tabitol. They need to see ophthalmology. That's a bad problem. It's a priority. Pyrazinamide, they can gouge. You teach them how to drink water. But after that, teach them how to avoid liver injury. These four medications, straightforward, and NCLEX pharmacology. They are antibiotic. The patient need to know. They need to be compliant with it. Take it for 6 to 9 months. If you don't take if you have TB, PPD, and you don't take it for that long, you become resistant. You get full blown, and you take four medication. So take care of yourself and have a good day. Thank you for watching.